board certified family nurse practitioner, got my master's out of Maine, St. Joseph's College. I'm board certified through the ANCC, and I'm certified also in Botox. So Passion Health is the direct primary care, so it's a model where you purchase a membership, and we don't take insurance. You can use insurance like for labs, and I don't know why I'm so nervous. It's like, calm down. You could use insurance for labs or imaging. We also offer cash pricing. That's very reasonable. I don't mark up any of the imaging, and the lab is barely marked up. So there's a lab panel that I do that my cash price is $280. And if you go to the lab, I have actually seen patients billed where it was billed at $3,200. And that same cash price for me is $280. So the labs are really affordable at my office. And they're also done in my office as well. If you're a member, you just make an appointment with me. You don't have to go through lab or anything like that, and they're drawn right out of the office. What's included in the membership? If you have a membership, you pretty much can look on here. Pap smears are done as well in the office. You're really only paying for the test itself, but everything else is pretty much covered under the membership if you're a member. So primary care management, urgent care, any urgent cares, if you get a lac, if you get a cut, if you're sick, anything like that, any flu, strep, any of that, it's no fees. All of that is covered under your membership as well. Of course, I also do mental health. I treat depression, anxiety, all of that. If it's a really, really, really bad case, I have a big referral base. And if it's something where I need to send you out, I will. If I have to put you inpatient, I will do that as well. I have a good connection to do that as well. As far as what's the difference between traditional and direct primary care. With traditional healthcare, a lot of you probably already are very familiar with traditional. DPC, direct primary care, is kind of new. Well, it's not new, but I feel it's new to a lot of people. It's up and coming. Traditional, of course, we all have the long waits, waiting for appointments to get in. I've heard multiple different stories of people waiting months to get in. If you're sick, you don't want to wait months. You need to get in pretty well. That's why people end up in urgent cares and acute cares. We want to keep you out of the acute cares and the urgent cares. If you're sick, we're going to get you in the same day. If you're a patient, you're going to get in the same day or the next day. That's guaranteed. And when you become a member, you get access to an app, and that app gives you direct access to me. So I will determine if you need to come in and be seen, if I could jump on a telehealth or even jump on a phone call. A lot of times appointments, you don't need to come in the office. If you're doing a follow-up, you don't need to come in the office. If you want to, you're more than welcome to, but a lot of times people don't have time. So I try to waste no time. Direct primary care, you get same day guarantee. There's a flat fee. There are no hidden fees. If you come in, whatever you're coming in for, you will know prior to me even starting what it's gonna cost, if it's gonna cost you anything extra as a member. And we do, like I said, preventative, we do a lot of preventative care as well. Who benefits? So individuals, anyone that wants to be on top of their health care, anyone that wants preventative and be proactive, individuals, like I said, there's a flat fee. The fees are based on your age. 18 to 39 is $65 a month. 40 to 64, I want to say, is 75, and 65 and up is $95 a month. That's the membership fees. Small business owners, currently, I think last I checked, I have about 7 small businesses, just bought on another one. So definitely a good benefit for people with small businesses that don't offer any benefits to their employees. It's really good. What I find is that a lot of employees, staff, actually have a lot of health issues that just get overlooked, or they don't tend to because they don't have any health care. So it's kind of a really good benefit. If you pay for their membership, they actually really utilize it a lot. Frequent asked questions. So these are questions that I get asked a lot. First of all, people want to know, what does it cost and how is it possible? I already went through the cost there. So the monthly fee, if you go back a couple of screens, it talks about kind of what is covered under the membership. It's a lot. Should I cancel insurance? We do recommend that you have some type of wraparound, insurance, some type of supplemental for emergencies and accidentals. Because if you're having a heart attack or anything like that, if you're having a true emergency and I need to send you to the emergency room, I am going to send you there. The good thing about that is I do have 20 years of experience in emergency medicine, and so I usually am pretty quick at picking up when something is an emergency. And I will also tell you, every patient of mine that I have sent to the emergency room needed to be there. They were admitted, something was going on with them. If you do not need to go to the emergency room, I am not gonna send you there. So it is important that if you are sent there, that you do have some type of coverage. So if you don't know what that is, and if you need help, I do have a group of people that are really good at pairing a good, very affordable plan with, direct primary care. What if I need to see a specialist? So I'm currently in the process of credentialing with Rubicon MD, and what that is it's a panel of over 200 specialists. So when you go to your primaries, who's had to be referred out to see a specialist? If it's a gastroenterologist, it's a cardiologist, if it's whatever it is. So I will be able to reach directly with them, speak with them as I'm sending you out as a referral, and basically based on what they would do, they would tell me to do, and I would order that. Recently, I've had 2 patients that needed to be referred to cardiologists. I got on the phone with them, spoke with them, they recommended a CT angio, I ordered the test, I ordered the medication, I reviewed the results. They did not need to ever go to see cardiologists, so that saved them a ton of money. They didn't even need to go for a consultation. Their CT angio came back good, and they were fine. So that is the purpose of Rubicon MD, so I don't have to refer you out to see specialists. I can handle all that in-house. Also, if you have PPO insurance, that is recommended with DPC. That does allow me, let's say if the specialist needs to do certain tests and you do have to go see them, that allows me to refer. The big difference I notice is that people with HMOs are upset and mad because a lot of times they don't like to see, they want to see who they want to see. The difference is when you have an HMO versus a PPO, you don't have that luxury. So I usually say I have a group of doctors that I like working with that work very well with me. A lot of times my patients want to see them, but if you're stuck in an HMO, a lot of times that may not work if they're not within your network. So it's better to have a PPO with direct primary care. And is there a commitment? Yes, there is a 6-month commitment when you first sign on as a new patient, but then after that, you can end your membership at that time, if you choose to. A lot of other services that we do, weight loss, Botox, hormones, facials, IV therapy, we do a lot of that. So these are just a list of a lot of the other services. You don't need to be a member to use any of those other services as well. And good referrals for me are health insurance brokers, financial consultants, personal trainers. Okay, well, this is a good referral for me, and thank you guys.